Oh, well, let's go to the brilliant Adam Creighton for a bit of common sense. Adam, what about all of that? And what about all of that? And what do you make, just before we do that, this announcement from the Queensland Government just moments ago, primary and secondary boarding school students with a primary place of residence in either the ACT or New South Wales can enter and leave Queensland, but only if the area in which they live has no COVID cases. Now, how would Mrs Creighton know when she wants to send her boy Adam back to school in Queensland? Mrs Creighton lives at Moree. How the hell would she know whether anyone in the district was a COVID case?
Well, look, it's just extraordinary. And as you've said, these rules are just totally arbitrary. And the fact is, throughout Queensland, Victoria, New South Wales, the vast bulk of local government areas have actually never had a case in the first place. And yet people are wearing masks. There's councils, hiring COVID consultants and so forth. I mean, it's just reached ludicrous levels. You and I spoke last week about those American statistics that haven't been reported. 6% of American deaths, only 6% could be attributed exclusively to coronavirus. Now we've got an Australian health report, unreported by anybody, 9% in Australia. What on earth are we shutting the nation down for when there are only 29 cases which are serious? Well, frankly, I'm surprised it was 9% because the Australian population is a fair bit healthier than the US population. There's also further stats out this week from Sweden that there it's only 5% of the deaths had zero comorbidities. So, look, more and more we're just seeing data from around the world that means that we can respond to this virus in a much more targeted way. But we're certainly not in this country. But, Adam, why aren't editors putting this information on the front page of their papers in order to tell the truth? Why doesn't the national government take out an advertising campaign to tell Australians the truth and dismantle all this alarmism and fear? Well, look, it's a very good question. I think the number one chart that should be on the front page of every newspaper in the world is the one that shows that mortality in Sweden is basically no different overall than from recent years. And yet there's a country that is, constantly attacked by these lockdown fanatic people around the world. And frankly, you can't see it in the raw data. Of course, a few thousand people have died, and that is very tragic, but they've been very elderly people. And the mortality stats suggest that they would have died soon anyway. And that is certainly how historians are going to see it in a few years' time. Well, as always, you've written a brilliant piece today. Share some of that with us about the people who are actually making a big quid out of COVID. Yeah, well, look, there are lots of vested interests that benefit greatly from the COVID hysteria. There's the pathologists. There's obviously the bureaucracy itself drawing up crazy plans, crazy arbitrary plans. But if you just take testing, for instance, we've done 6.6 million tests, and actually, mind you, only 0.4% of those tests have been positive. That's about $1.3 billion that's flowed to the various vested interests who are responsible for conducting those PCR tests. So certainly, that aspect of society would be quite happy with the testing to keep going on. And the dispute lawyers and all the rest of us. Tell us, please, because everything's COVID now. COVID marshals, COVID, the whole kit and caboodle, jobs being aware. Yeah.
What? Yeah. Tell us about Theresa. Tell us about Theresa Tam, who's Canada's chief medical officer. She recommends COVID-safe dating and sex. That's right. That's right, Alan. I mean, it's somewhat crazy. Hard to believe that she even issued this public statement. But yeah, she did advise Canadians that if they were to have sex, that they shouldn't kiss and they should wear masks. So there you go. Is that peak stupidity? I think maybe it is. I think we've jumped the shark as a society. But perhaps she was inspired though by Queensland, because that government in July drew up these COVID safety plans for brothels and saunas and cruise clubs. So there you go. They're about 10 pages long each. You can read them online. Yes. And it's just extraordinary. 24 Queensland, 24 mandatory COVID safe industry plans. Each is 10 pages. Sport, caravan parks, but there's a separate plan for brothels. For brothels, cruises, clubs and saunas. And of course, New South Wales, now you said, is advertising 113 jobs with COVID-19 in the description. Yeah, look, that's right. And that's just one state government. We've got this stuff forever. There were 4,400 jobs advertised on Seek with COVID-19 in the description. So it's not just the public sector. This is now a phenomenon. It's just like the climate change phenomenon. It creates a whole industry, a vested interest that wants to sustain it. And sadly, it's going to be hard to extricate ourselves from it. I mean, the logic of lockdown, as we're seeing in Victoria, is once you're in it, it's very hard for the leaders
to get out of it, because if there's a jump in cases, then people will quite rightly say, why on earth did we do that?
Perhaps in the first place. Good on you. We love your common sense, Adam Creighton. You're an absolute star.
Thanks, Alan.
We'll talk to you next week. There he is.
Yeah.
There he is.